morning, ladies and gents, and thank you very much for listening to our presentation today. I suppose ours is a little bit less conventional than the other two presentations that we've seen this morning. One is still running the improvement project nonetheless. Our intended aim for our healthcare improvement project was to improve emergency response systems surrounding the Ebola virus disease and to control future outbreaks. So without further ado, our presentation today will have a quick explanation of the setting that we've chosen. Also a quick snapshot of what Ebola virus disease is. We'll look at some of the literature and evidence, our intended improvements and proposed methods, and then we'll have a look at our intervention assessments, some of the challenges that we face, and a quick Q&A if we have some time. So a snapshot of Ebola virus disease. It originates from the genus Ebola virus, and currently there's no confirmed reservoir as yet. The spread to humans is via consumption of bushmeat, primarily from fruit bats, and it is transmitted via direct contact with infected persons' bodily fluids, including vomited blood, feces, and semen. The incubation period for Ebola is 2 to 21 days, and some of the symptoms include macular rash, malaise, diarrhea, bleeding, and currently there is no available cure-only symptomatic therapy. The setting that we've chosen to look at is based in 3 countries, so it's quite broad: Liberia, Guinea, and Sierra Leone, which are all located in West Africa around the Mano River Union. And to give you some idea of some of the country-specific health backgrounds and some of the context that we looked at, you can see that they're quite large populations in relation to their land mass, and roughly half of those countries' populations are living in rural areas, and they adopt a hunter-gatherer style of life, so there is quite a high risk of contracting the virus given their hunter-gatherer practices. A lot of these, the majority of these countries have populations that are below the poverty line, above 50%. And also religion was an important contextual factor, given that their burial practices are also another common route for transmission. Also something to note is the amount of physicians and nurses per thousand of population, which is quite low. So that just goes to show that there's quite a massive burden on their healthcare system. I'll hand over to Marsh to have a chat over.
Yeah, the literature reviewing our project showed that this whole Ebola outbreak occurred under the backdrop of a setting where the healthcare infrastructure was really poor. There were no standard safety level 4 labs. The healthcare workers were few in number. The ones that are like public health trained were also very few. The whole outbreak coordination by both the national government and the global health organizations were really poor and inadequate. Conspiracy theories have also fueled these outbreaks, such as the fact that people think that this virus was manufactured in Western labs and brought to these 3 countries. Cultural practices such as burial practices, handshakes, and the eating of bushmeat has also shown to fuel the outbreak, and so it has really hampered social mobilization efforts. These 4 photos will show you some of the challenges that these 3 countries are facing. This is just a picture showing you children who are patients outside of a treatment center, probably because of lack of availability of space. This is also a lab worker showing you he's supposed to be dressed fully protected for bio-level 6, safety level 4, but you can see he does not have goggles, he does not have a hood and that kind of thing. And you can see also here the amount of patients in the treatment center, some lying on the floors, those kind of things. This is and the social mobilization effort that was going on. So this is the standard WHO outbreak response process map that has like 4 to 5 phases, and you can see the days allocated. So within 60 days of an outbreak like this, the outbreak is supposed to have been controlled if all of these measures are put in place that you can see here. The ones now like surveillance and the assassinates and the logistics. But in the current epidemic or outbreak, a lot of the whole outbreak is stuck between the alert phase and the control phase. It took about 90 days from the time the outbreak was started in Guinea for it to be confirmed. And then since then, the control measures are still ongoing. So we are still stuck here. We are yet to evaluate or to come to the end of the outbreak. But you can see from the dotted red arrows what would happen if the outbreak was controlled. So as a team, we decided that these are some of the intended improvements and how we are going to achieve them. We talked about strengthening local Ebola viral disease responses by strengthening the public health measures such as surveillance of wildlife monitoring and providing the fund for these measures to be put in place. Building of laboratories, especially in the border towns and in certain specific regions of the country. Quarantining and border control. Building adequate treatment units, especially at the epicenters of this outbreak. And also social mobilization. Because of the myths, misconceptions about Ebola, social mobilization is really, really key. And you can do it through the ways that have been outlined here. A lot of healthcare workers have been infected during this current outbreak. So their protection and knowledge about infection control measures is key in preventing future outbreaks and also in controlling this outbreak. So if all of these 5 factors are done correctly and in a coordinated manner, we are sure that future outbreaks of Ebola or any other viral hemorrhagic fevers will be controlled. And also, if the animal welfare is surveillance well, it will serve as like an early warning system because normally the Ebola outbreak normally precedes, it happens first in the animal groups before the human population. And there was a problem in the way we could assess the interventions, but we thought that if all of these interventions were done properly, we will see a reduction in the number of healthcare workers and that are infected, as well as the population of Ebola cases. There will be also an increase in the number of patients presenting to the emergency treatment, Ebola treatment unit. The number of people in these 3 countries also have huge awareness and knowledge about what causes the Ebola outbreak and how it can be prevented. So in future, you can see that future outbreaks will be controlled or they will be contained very, very easily. Some of the challenges were the fact that this was an evolving outbreak. It was really, really unprecedented in so many ways. And finding accurate data was really, really difficult, especially from the ministries of health from these 3 countries. So we relied mainly on the WHO data and the CDC. The scope, as you can see, was really, really wide. We had to deal with 3 countries and with different languages and contexts and cultures somehow, you know. And so in conclusion, this epidemic is, of course, rapidly evolving, and we've agreed that the Global Health Organization, as well as the national responses, we are really, really low. But what we can see is that if I can go back to, if you can go back to the process map, the pre-preparedness level is really, really key and crucial. If you get it right at that level, you can easily prevent future outbreaks. And Nigeria and Senegal have shown that Ebola can be controlled. So we need to follow their footsteps and join hands together and keep Ebola out of the world. Thank you.
We have 1 minute for any questions. Oh, we got another one. Bring it on.
So I think in your proposed intervention, so how do you think about the acute case management of Ebola patient? Because you mentioned only the strengthening laboratory service. We know that this is essential, but I think to develop the BSL goal lab is a very huge investment. How about, because some health professionals argue that acute case management is also important in the Ebola outbreak control. Because without laboratory investigation like that, because the main cause of death in the Ebola patient is the fluid electrolyte imbalance. So how to deal with this issue in the acute case management setting because they have the no machine, no equipment to analyze the fluids and electrolytes level of the patient.
Yeah, thank you. You want to answer?
Yeah, so our recommendations are, they're general, because what we've learned from the current outbreak is that it's going to happen anywhere in the world. So it's going to be context specific. So support and treatment measures in Africa is going to be very different from the ones happening in the US. So that's why we haven't talked about a cure or a vaccine. What we do know is that if people present to the treatment units early, they have a higher chance of survival. So that's what we're trying to push. We're trying to push people to come to the treatment centers when they notice they have symptoms, instead of waiting until they're bleeding, which is the point at which we can't help. So if they present early and we do the supportive therapy, hopefully in the future we'll have other things that are happening, like the blood transfusions again from field patients.
Excuse me. Sorry, I just want to touch base that we are talking about the improvement of emergency responses. We're not talking about clinical management of the cases. So basically we didn't touch that really because it was not really relevant.
And just to add to that, for us, dealing with the clinical management would have been very difficult because having actual information, we have to base our improvement on knowing what's actually happening in treatment units now. And that's information that you cannot get at all. So we decided to focus on the actual country response based on the WHO standard that has been placed, preparing the country and then being able to respond and alert as early as possible. The sooner you can do that, the faster you can be able to identify cases and separate infected people from non-infected people.
Fantastic. I think it's worth a round of applause. Project, there's always the potential for scope creep. So we went out to do this. While we're there, we'll do this. We'll also focus on interventions and and it becomes unmanageable. So very nice. They focused on their area. How are we going to fix this? Let's make this happen. While these guys are set up, you've had 3 presentations so far. Which one is